Well, I think CAR T for myeloma has really been a pretty rapid revolution in terms of therapeutic options, particularly in the context of refractory myeloma, where patients had very few potential treatment options. What we've seen is really two approved CAR T cell products, both ide-cel and cilta-cel, with slightly different in terms of timing for CRS or ICANS. But I think in general, what we know about BCMA-directed CARs is that the grades and severity of both CRS and neurotoxicity are essentially one grade lower than what we see with CD19-directed CAR T cells in other diseases. I think these are really exciting times, and certainly with the CARTITUDE-1 study showing very long progression-free survival, we're hopeful that there's a plateau on that, suggesting we're curing patients, but we'll just have to see. Well, again, when we think about what this really offers patients, it's a couple of things. One, obviously, it's a very high response rate, higher than what we've seen with pretty much any other therapy we've got out there. If you look at cilta-cel, 97.5%. If you look at ide-cel, somewhere in the 70s. That's certainly better than we've seen with other agents. And as a single agent, it's very active. The second is the ability to discontinue therapy. So patients are off therapy for as long as they remain in remission, which is, from a patient perspective, really a nice bonus, if you will, because they get back to their lives, they get back to their work, and they don't have to come in and see us quite as often. So those are really great, particularly in the context of refractory myeloma. Blood Cancers Today is a really neat periodical that sort of gives you very quick, up-to-date ideas in terms of management and the way that people are thinking, particularly leaders are thinking in the areas of blood cancers. And we know that as a field, blood cancers are moving very fast. New drug approvals, new changes in standard of care, and new treatment paradigms are coming almost on a monthly basis. And given that very rapid turnover, it's often hard to keep up. And what Blood Cancers Today really offers is state-of-the-art discussions, articles, and updates in terms of what the meetings and congresses have told us, but also their own spin on things. And certainly the debates, the pros and the cons, the commentaries, all I think give us a window into this world, and it's access that you get that it's hard to get anywhere else. Being back in person for SOHO is really wonderful. This meeting has grown over the last decade. This is the 10th anniversary of SOHO. And I think just seeing friends and colleagues in person, being able to have live discussions about some of these changes, catch up on family and other things like that, it's really great to be back in person again, and seeing so many people wanting to hear the information presented at SOHO in person is really very encouraging.